This is a CT scan that was performed in a patient with a history of prostate cancer looking for metastatic disease. Now, in the spleen in this particular patient, you can see there's this lesion that's hypodense, fairly well defined, measures about 5.9 centimeters, and it really becomes a question of, well, what do you do with these particular lesions? Splenic lesions are quite common. Most of them are benign. They represent cysts or hemangiomas or hamartomas or lymphangiomas, and so it's not uncommon to not necessarily recommend additional follow-up, just given how frequently these occur. Additionally, the follow-up for these often requires biopsy in order to actually make the diagnosis. So if you're not interested in biopsying a splenic lesion, there's probably not a whole lot of need to be able to do additional imaging for these particular patients. In fact, there was a paper in Radiology that discussed this, and for patients who are asymptomatic, who aren't having any symptoms associated with a splenic lesion, it may be safe to not necessarily follow these up. And so the idea of metastasis was considered, but a solitary metastasis is considered unlikely. Lymphoma is also in the differential diagnosis, but this would be isolated splenic lymphoma since we don't see any abnormal lymph nodes elsewhere. And so that was considered unlikely. The patient ended up coming back a little while later and was having abdominal pain at this point. And now you can see that this mass has exploded in size, is now involving the entire portion of the spleen, is extending out into the splenic hilum here, and you can see it actually involving the left wall of the chest, going in between the ribs. You can see that there's soft tissue density going there as well. And there's some central areas of either hemorrhage or necrosis. One of the things to look at as well is to make sure that there's no splenic rupture, so you'd want to look for free fluid within the peritoneum, and in this case there's not a whole lot of free fluid to suggest that's what's going on. In addition, you can actually see soft tissue encasement here around the celiac axis, and when we come down you can see some left periaortic lymphadenopathy as well as some lymphadenopathy around the crus of the diaphragm. And so this ended up being biopsied and was found to be a diffuse large B-cell lymphoma. So this was a case, an unfortunate case, where we have an incidental splenic lesion that was thought to be benign but ends up being lymphoma.